I'm Ryan Sinclair. I'm an associate professor in the School of Public Health at Loma Linda University, and that's in California in the U.S. And my
Yeah, okay,
camera
cool.
doesn't seem to be working. I don't know what's going on.
Yeah, and you're a little soft. I am recording the session to the cloud, so hopefully that's okay with everybody. But if you want to have a more personal discussion or would like me to not record, just please let me know in the chat. So I think everybody's introducing each other. Let me get the short link to the Google form. I'll just share screen as well. But you're welcome to start inputting like any policy recommendations you have. We had the guiding questions that Katie talked about like what policies and programs can be expanded upon or changed to improve data collection in high income countries, what models are working, and what examples do we have for the success of data collection in high income countries. So we're looking for like 3 to 5 concrete calls to action for high income country policymakers at the end of this. And there's the Google form if you're interested to stay involved, or we'll like have like sort of how they have those online petitions if you want to sign them. But are there any questions about this? We can keep it pretty informal. We're a small group. If people want to speak up with some of their recommendations, we do have like 15 minutes, so try to be mindful of time for others to be able to contribute. Drew, do you mind if I cold call on you for you've done a lot of research in this space? So is everyone, I think, on this call, but
I think maybe I'm going to jump to point major challenges for adequate data collection, and like a critique of my own work that I have, or is really similar. There is some data on access in the United States and other high income countries, but we don't have a lot of good data on quality and the quality of that access. So especially if we're looking at drinking water quality, we can use like the census data to look at maybe who doesn't have piped water or who doesn't have complete plumbing. But if we're looking at microbial or chemical water quality, there's still a lot of data gaps in terms of our understanding there. I can put that in there. And I'm Drew Capone. I'm a postdoc at UNC.
Yeah, thank you. Anyone else want to contribute? Aaron, yeah.
I'm Aaron Best at Hope College. I'm a microbiologist. So I'm going to follow up on that comment. I wonder also, in addition to the data gaps, filling those in, making sure that there are integrated database systems accessible to all that actually allow you to aggregate all of those data across states in the U.S.
So data systems and data gaps, and we do want to make recommendations. We can target certain countries, but that are representative to other high-income countries like in Europe or Australia as well.
Right, I would think that would go across all places.
Carmen, did you have some recommendations?
I want to briefly just mention one of the challenges of data collection for ethnic minorities in Europe. So one of the major challenges is actually ethics and ethical issues. So for Roma communities in Europe, for example, it's very difficult to find data and to collect data also that highlight that these groups are the ones underserved, because it's not allowed to capture this information at all due to the history of racism and discrimination and persecution too. So they remain completely hidden in statistics, and we know that they face challenges, but the data is not visible. That's one. And it's also oftentimes discouraged by governments actually to report this kind of information about certain population groups.
Thank you. So what would be a policy, like just ensuring that it's equitable data collection? I don't want to keep adding adverbs so that we can, this is just like a
It's
draft.
a very difficult one that we've been trying to address for a while, right? But I think it's really a question of dialogue with the decision makers in the countries where Roma make up the larger part of the population. I mean, every country probably in Europe, and try to have representatives of these communities participate and try to somehow find a way that their voices can better be heard and the situation better be represented.
I liked about on the Roma discussion earlier from Adam. I liked how he was describing how the large funding mechanisms are often targeted towards these very kind of sketchy interim solutions, and I think it's just a lack of agreement to take things seriously for these disenfranchised populations. So this goes to data as well, like people just don't, or policy just doesn't prioritize data collection in rural or informal communities.
I think it's not even data collection. I think they don't. I mean, in many countries, we've had this discussion with a researcher from Slovakia, not the one on the panel earlier, but at least that's what he reported for Slovakia, that it's not even only about data collection, but really those population groups are not the priority at all. They're being oftentimes kept from the public life, and they're not really represented at all. So no policies on their, policies on their behalf are very difficult to push through in certain countries, or advocacy for them too is very difficult to achieve.
Like, on that note, it's easiest to collect data on the people who already have the services, right? And it's hard. So for the folks who still lack access or quality services, those are the hardest ones to reach and understand. So it is rethinking how are we collecting data to make sure that we're equitable in that and not just overlooking certain groups.
Yeah, Drew, I completely agree with you. I think one thing that I've been thinking a lot about is how those that are not connected to households or institutions, how do we collect data on them? And I think moving away from household wash in high-income countries and focusing maybe on access to what access looks like in public spaces, especially given COVID and increases in public facilities, including hand hygiene facilities. I think that's an area that we can easily expand upon. And then just one addition related to kind of this equitable and comparable data collection. I think we would want to emphasize that these are also very contextual, that the data need to be contextually grounded, since these are marginalized communities. We don't want to be highlighting issues such as like open defecation that ultimately lead to more police or policies that are harmful to those that lack access and are having to openly defecate and then face legal consequences. So I think, yeah, being very strategic about our data collection and how we're framing it is important to kind of overlay on all of this.
Yeah, and trying to frame that communication to tell a positive story, right? So if you are going to be communicating the data, that not just saying, hey, there's an issue, but hey, like I guess what on question number 3 there is, if we're going to be talking about models, we're promoting ones that are working and are having a positive impact, such that the story, as April said, isn't a negative one about issues, it's about solutions.
I really like about may I?
Oh yeah, of course.
I like the comment about non-household, or looking at non-household setting more. particularly for unhoused communities, but also for nomadic or semi-nomadic or not sedentary communities, and thinking about also at the point of contextualizing more and maybe using social science a bit more too, to understand how do communities live. So thinking more about how can we target certain groups, for example, what kind of maybe religious habits do they have, where do they meet together, where can we possibly approach them, or what are common activities or typical meeting points and places where we can interact and get a hold.
Yeah, all great points. I'm trying to write where I can, like these notes, but feel free to edit, and we will like take some time to synthesize after this session and aggregate. Curtis, did you want to make a point?
Yeah, hi, I'm Curtis Coot, and I work in environmental public health surveillance for the Oregon Health Authority. And one of the things we're trying to do is build that public health evidence base to support policies for a human right to water for people in Oregon. And you know, some of the things that we're encountering really on the ground data collection issues include, you know, we have very limited information on the boundaries of water systems, which makes it then difficult for us to understand the demographics of those systems. You know, what do we know about the communities served, whether they're housed or not housed within those systems? And then what can we say about the people outside of those system boundaries that are living on you know, domestic wells or surface water sources? So, you know, just the real lack of system boundary data and the lack of effort to systematically collect, you know, that water access, water quality information that we used to have in the census or the American Housing Survey and places like that. Those need to come back.
Okay, great points. Is it? I heard they are coming back, but it won't be for like the next 10 years maybe, or that. Well, it's in the ACS survey. I don't know if there's similar issues in Europe or Australia with census lacking data as well. But that's only what I know. IAPMO is pushing for it to be added back, but even then, not everybody responds to the question. Oh, Curtis, or sorry, Aaron.
Yeah, I was just going to add in the notion of this being a long-term approach. It can't be funded for, you know, very short-term projects that then don't connect to anything else, et cetera, et cetera. It has to be a systematic approach with long-term sustained funding.
Long-term sustained funding. So for our 3 to 5 points, I mean, these are great responses to the questions too. Are these looking okay, or do we need to add some of what we've been answering in 4 and 5? Brooklyn, can you add some of these, like abbreviate these points to the Google slide?
I guess one quick thing, and maybe we don't have time to discuss it here, but to point 3, I think being really clear about what we mean by public facilities, because I think some of the guidance from WHO and UNICEF includes commercial buildings as public facilities, so like bathrooms in commercial buildings. And I think for certain populations, that is not a true public facility and people don't have access to that. So being really clear about what we mean by public facilities and what the ask is, and for who are those buildings public to, or who are those facilities public to?
A great point. I think, yeah, well, how would you frame that? I said public facilities accessible to, would it be unhoused populations or, uh, I debate between, like, I know we're trying to not use marginalized anymore, or there's underserved, so people have a priority name that we should use also, let me know. They are giving
Yes,
us
I
an
think
extra
it's,
5 minutes, so.
I guess I think maybe specifying that that is not like I think that we cannot rely on commercial facilities to fill this need. I guess to get around like the large bucket of like, are we talking about unhoused populations or other types of populations? I think it's just like clarifying that like public facilities are not the same as commercial facilities. And that we often conflate the two, even though they're quite different.
And on that, I think also the groups that use them are not only the unhoused populations in the large urban areas. Like in India, plenty of housed people have to go into the urban area every day, and they don't have a place to use the bathroom, so they do open defecation and that as well, and they're still considered housed. So yeah, there's that difference as well.
Yeah, good point. So I just put increase access to wash in public non-commercial facilities. Maybe that's okay. Erin, you had your hand up earlier. Or was it, yeah?
It was from before. I took it down.
Yeah, Carmen, do you have a point here? Is this, I was trying to word what you were saying that was really important about like a lot of these communities are ignored.
I think it's really a matter of involvement. I mean, if certain communities are not represented politically, then they will not be served. So I think it's really how can we better capture some of those communities' voices and implement actions to meet their needs. So it's really about, finding ways to better represent them. And therefore we need to put them at the same, we need to have them at the table when we talk about what solutions are needed. So I'm happy to help formulating this later on, but I think it's really about involvement and participation in a way.
I think part of that, I know a lot of times when we think about data, we focus on quantitative data.
Yeah.
And
Yeah.
I think, having a focus on that qualitative data, gathering the stories, and bringing those perspectives, first of all, bringing those perspectives to policymakers so they can appreciate those perspectives. And as Carmen is saying, including those voices and the perspectives in the policymaking, in the data collection, that needs to be, there needs to be a focus on that inclusiveness.
Great points.
I tried to summarize that under the point 6, which is stakeholders and actors.
Mm-hmm. Yeah, really, it's written well. It's going to be hard to choose. Well, we have 3 to 5, so.
I really like the comments of Curtis on qualitative, using methods to capture those voices as well. So I think this is something we should add to the list as well. Although, of course, it's very difficult and maybe not feasible for many to implement this, but it's the most useful way to represent the situation, maybe. Or at least to understand the situation and the challenge first before thinking about how we can try solving it or addressing it.
Good points. Any last comments for 2 minutes? I'll also save the chat and make sure you fill out the Google form if you want to be involved in editing later.
It looks like we have one positive story up there. Are there some more that we can think of?
Does anyone have positive examples they've been involved in, or with Oregon, they're doing better now, right?
I think there are quite a few like public hand washing initiatives that have happened in the US. I know there's a program called Love Beyond Walls. There's also some programs in LA where they've taken kind of like rain barrels and made them into hand washing facilities, and they were like community art projects. So I think there's some hand washing examples, yeah, and Lava May as well.
Yeah,
I'll find
awesome.
citations for the other ones. I'll add them to the Google Doc.
Yeah, I think, yeah, we'll keep this up online. Yeah, I know that this could be a whole day discussion, so I really appreciate everybody's input in discussing this further. So we'll head back to the main room for a report out from the other groups, but thank you so much, and yeah, continue to add, and we'll try to get this out there as well. I hope you have a great rest of the conference too, if I don't see you again.
Thanks, everyone.
Thank you.
Thanks, everybody.